Obesity has quietly become one of the defining medical crises of our time, now affecting hundreds of millions worldwide and driving type 2 diabetes, cardiovascular disease, and even mental health challenges. In response, the weight loss market is shifting away from fad diets and quick fixes and toward physician-led, evidence-based programs powered by GLP-1 medications, precision nutrition, and digital health. In this video, we count down the top 10 medical weight management trends that will define 2026 and how clinicians can ride this wave instead of chasing it. Trend number 10. Obesity treated as a chronic disease. Medical authorities like the WHO, AMA, and major European bodies now formally classify obesity as a chronic disease, reshaping long-term treatment, coverage, and clinic strategy. This chronic disease framing demands multi-year care plans, not 12-week programs, and opens the door to expanded reimbursement for prevention, pharmacotherapy, and monitoring. Integrated teams, physicians, nutritionists, and behavioral coaches gain a competitive edge because they are positioned to deliver reimbursed, holistic care. Trend number 9. From reactive care to prevention, healthcare systems are moving from fix the crisis to prevent the crisis, with lifestyle medicine and integrative care entering the mainstream of obesity treatment. Corporate health programs, community initiatives, and employer partnerships are focusing on obesity prevention to cut absenteeism, healthcare utilization, and lost productivity. Lifestyle medicine is now a credentialed specialty, and programs that combine lifestyle coaching with GLP-1 medications are emerging as best practice, not optional extras. Trend number 8. Plant-based anti-inflammatory nutrition. The Eat Less, Move More era is over. 2026 nutrition focuses on metabolic optimization rather than simple calorie restriction. High-fiber, plant-forward, anti-inflammatory diets are gaining traction for their impact on insulin sensitivity, microbiome health, and systemic inflammation, key drivers of sustainable weight loss. The new macro conversation centers on fiber quality, nutrient density, and glycemic impact, and practices are building nutrition protocols into GLP-1 and device-based programs as standard of care. Trend number 7. Precision medicine in daily practice. Precision nutrition and pharmacogenomics are moving from theory into real-world workflows in 2026. Genetic and pharmacogenomic panels help predict who responds best to GLP-1's dual agonists or agents like metformin, while microbiome sequencing guides diet and probiotic strategies. DNA and microbiome data let clinicians stratify patients and match them to the right medication and nutrition plan, improving outcomes and adherence. Trend number 6. AI coaching and virtual clinics. AI-driven coaching and telemedicine are transforming how often and how deeply patients are supported between visits. AI tools can interpret wearable data, food logs, and behavior patterns to deliver personalized nudges, like recommending extra protein on high hunger days or flagging late-night snacking linked to poor sleep. Predictive models can anticipate plateaus or weight regain, while virtual weight clinics and telehealth-first models expand access in rural and underserved communities. Trend number 5. Whole person behavioral integration. 2026 obesity care is not just about the scale. It is about psychology, stress, sleep, and stigma. Digital behavioral therapy tools, CBT modules, mindfulness apps, and stress management programs are being embedded into medical weight loss plans. Sleep deprivation and chronic stress disrupt hormones like cortisol, ghrelin, leptin, and insulin sensitivity, while GLP-1 pharmacotherapy plus structured behavioral therapy outperforms either approach alone. Trend number 4. Non-invasive tech and aesthetics. Non-invasive technologies are surging to support appetite control, metabolism, and post-weight loss aesthetics. Neuromodulation devices, Earworn or skin patch wearables that modulate vagus or hypothalamic signaling aim to reduce cravings and improve portion control without additional drugs. Cryotherapy, local cold exposure, and non-surgical body contouring, ultrasound, radiofrequency lasers, are being integrated into comprehensive after GLP-1 plans to address thermogenesis, recovery, loose skin, and residual fat. Trend number 3, the rise of oral GLP-1 medications. The oral wave of GLP-1 agents is a major 2026 inflection point, lowering the barrier for patients who dislike injections. Rybelsus, the first oral semaglutide, showed meaningful weight loss at higher doses, paving the way for second-generation agents like Orforglipron and Danuglipron. Orforglipron has demonstrated around 11 to 12% average body weight reduction in trials, while twice-daily oral Danuglipron aims to deliver injectable-like efficacy without needles or complex absorption protocols. Trend number 2, next-generation dual and triple agonists. After dual agonists like tirzepatide, triple agonists targeting GLP-1, GIP, and glucagon are emerging as potential game-changers. Early data on agents such as retatrutide report weight loss approaching 30% in some settings, alongside favorable changes in lipid profiles and cardiometabolic risk factors. Glucagon receptor stimulation appears to increase energy expenditure and thermogenesis, enabling clinicians to individualize treatment intensity by BMI, metabolic phenotype, and tolerability. Trend number 1, integrated certified GLP-1 led care. The top trend for 2026 is the convergence of GLP-1 pharmacotherapy, technology, nutrition, and lifestyle into one integrated, professionally certified care model. Physicians, nurse practitioners, and allied providers are pursuing specialized credentials, such as the Certified Medical Weight Management Provider program from IAPAM, to standardize protocols and outcomes. Clinics that combine GLP-1s, digital monitoring, behavioral support, and aesthetic options can position themselves as comprehensive weight and wellness centers rather than single-service injection clinics. Obesity medicine in 2026 will belong to clinicians who treat obesity as a complex, chronic disease and build structured, GLP-1-led integrated programs around that reality, not to those offering short-term, fad-driven solutions. The Certified Medical Weight Management Provider pathway and IPAM's training give you the protocols, GLP-1 titration strategies, and business systems to implement this model safely, confidently, and profitably. Take the next step today. Enroll and establish your practice as the leading GLP-1 centered weight and wellness destination for 2026 and beyond.